When you talk about healthcare, you're talking about big money, you're talking about hospitals, your big organizations and all that stuff. You're also talking about you and people you love and what's going to happen to you.
The mission of the Quality Institute is to enact and implement projects that are relevant to improving patient safety, patient quality of care, patient cost containment.
The actual access to care for people in the state of New Jersey.
The type of groups that join the Quality Institute are groups that are committed to making the world a better place, in particular the healthcare system a better place. And that's what we're all about, is driving change for the better.
By many objective statistics, New Jersey has some of the lowest quality healthcare in the country, while at the same time our healthcare is very expensive.
I think the Quality Institute really came about because employers and labor union leaders and healthcare payers were spending a lot of money on healthcare, but they didn't have a sense of if it was working. Were they spending their money in the right way? Was it the right care at the right time? What was their return on investment?
New Jersey rated very poorly in almost every aspect of care. And safety and cancer levels, almost anything you wanted to look at for the state of New Jersey, we were way back in the pack of states.
A number of other types of reports coming out saying, 98,000 people a year die because of mistakes in hospitals. And Dave again just said, well, what about quality?
If you negotiate quality and get good quality, price will be controlled.
Quality reporting? That was something that no one could agree on at the time. What is quality? What is that definition?
Nobody was reporting. Hospitals didn't report quality data. It was secret. And we published it. We put it in the newspaper and ranked the hospitals. That was the first public reporting of hospital quality data in the nation. And that was in February 1992.
Now that's become more refined over the last couple of years, particularly with healthcare reform. But prior to healthcare reform, we were really pioneers in saying, we're going to look at the cost-quality equation. We're going to look at safety. We're not only going to look at it, we're going to publish it. And once that started happening, people got really, we got a lot of people's attention.
We have almost all the hospital systems, the health insurance plans, consumer groups, physician groups, nurse-led organizations, pharmaceutical companies, really everyone who's anybody who is doing business in healthcare or is impacted by healthcare in New Jersey, to really look at issues not from their own perspective per se or their own parochial interests, but to really look at how they can work together to improve things for the system.
We worked on price transparency across pharmacies where there were disparities in drug prices. We worked on legislative efforts to improve access to Medicaid and to family care for New Jersey's families. We worked on accountable care organization projects to bring new ACOs and patient-centered medical homes to New Jersey.
Leapfrog Safety School. We were recruited into their second wave as a rollout, and then I went on their board almost immediately. If you walk around and see the A, B, C, D, F on the walls of hospitals now, that's Leapfrog. That was when I was chair, we did that.
We created a Mayor's Wellness Campaign, which is the opportunity for the many mayors across New Jersey to promote health in their communities and to make it a priority in their communities. We have now over 360 municipalities as part of the Mayor's Wellness Campaign.
It's just an investment policy. You make the investment in keeping people well, you get the dividends of reducing the problems associated with sickness and the costs associated with sickness.
One of the newest parts of the Mayor's Wellness Campaign is something called Conversation of a Lifetime, where we're actually working with 3 communities and they're talking about a very difficult subject for some people, end of life and end of life planning, and having the conversation with your loved ones about what your wishes are for your care at the end of life, and then making sure that you put those wishes in writing. Another initiative that we spend a lot of time on is what's called our QI Collaborative.
It's to improve the health outcomes and the costs of Medicaid patients and other underserved within New Jersey.
The QI Collaborative was originally based on a innovation and program work that Dr. Brenner was doing in Camden, New Jersey to reach our low-income, high-cost, high-risk patients.
In healthcare, there tend to be a lot of constituencies that are pushing for their self-interest. So associations represent hospitals, they represent doctors, they represent pharmaceutical companies, and they're often self-interested. They're pushing for their own specific agenda. And the New Jersey Healthcare Quality Institute's been one of the few entities that just stands up for better care.
The United States could do better when it came to healthcare, and we should really demand higher quality. We should demand safety. We should challenge physicians. We should challenge hospital leaders, and it's okay to challenge them, and they should be ready for the challenge, and that it's okay to shine a light when there's problems, and they should embrace transparency because that's really the way to get people to improve.
If your hospitals are safer, if your healthcare is better, if you have more information that gives you an opportunity to decide where to get your care and how they do, in part you can thank Dave for that.
There are always going to be complex questions in healthcare to answer. How do we keep bringing things from the darkness into the light? How do we keep enhancing and improving quality reporting and patient safety? How do we continue to foster innovations to improve the healthcare delivery system, to address cost containment?
And so I was never any question in my mind that Linda was who I wanted for this organization.
I think the opportunity going forward is that the Institute can be a catalyst for collaboration, bringing together the providers and saying, let's do something better. Let's create a future better than the present that we live in. And I think that's what the Institute's going to do. It's going to help create a future better than the present we live in.